you really should be encouraged that you're going to be okay, right? There are good management of low back pain. We help hundreds of people on a yearly basis to get their lives back and get their back pain under control. I myself have suffered with back pain. I got to the point where I was considering surgery because I didn't know what else to do. However, I stuck with my training. I went to physical therapy. I did the things that I was supposed to do, and I am now able to do everything that I want to be able to do. I can go hiking, I can go wakeboarding, I can do whatever I need to do. But I know when you're in the thick of it and you're having severe back pain, you just want that pain to go away now, right? And although it sounds like a kind of a nice, shiny, tie it up in a bow and just give me a pill, just give me an injection, just do a surgery and it's over, it's not that simple. And so we want to educate people that there are long-term solutions to managing low back pain, and we can help you with that, right? So my name is Ryan Seifert. I'm a doctor of physical therapy, and I have been working with people that are 50 plus who've been suffering with back pain for over 10 years now. And we're going to talk about some of the most common myths um, that we come across when talking about the best treatment of low back pain. There's a lot of, as physical therapists, it's our obligation, or at least we feel it's our obligation to stay up to date on the most current research and the evidence-based practice of what to do to actually is most effective for helping people with back pain. However, there's a lot of information out there, and there's a lot of false information. There's a lot of outdated information, and there's a lot of stuff that's just flat out wrong. And so, what I'm going to do today is talk about the three most common myths about managing low back pain. We're going to talk whether you've had low back pain recently or you've had low back pain for years. We're going to, whether you've had it from a fall, from an overuse injury, from an old sport injury, whether you've had an MRI and showed disc degeneration or disc bulges or herniations, or you have arthritic changes in your spine. We're going to talk about what to do and what the research really says is the best way to manage low back pain. Myth number one, if you have back pain, you need to get an x-ray or an MRI to be able to understand the root cause. We hear this all the time, and in fact, this is probably the most misconception that I have in the medical field when it comes to the treatment of low back pain, right? So I put myself in someone who's suffered back pain myself. I understand where people are coming from. My back hurts. Um, it doesn't seem to be getting better. Maybe the advice that I've followed so far from other people isn't working. Um, I want to I want to know what's going wrong, right? And it makes sense that if I have this imaging of something that I can take an X-ray and MRI and it could just tell me what's wrong, then I want to know what's wrong so that they can go ahead and fix it. However, it's not as simple as that. Okay. And so um, the actual best practice treatment guidelines suggest that imaging should only occur if the clinician suspects a specific condition that will require different management. Okay. So there are situations where an MRI will be needed, but in the majority of cases of low back pain, non-specific low back pain, especially if we're talking about pain that does not radiate into your legs, there is no need for an MRI. It's not going to change the best treatment practices. And in fact, it can actually make things a little bit more confusing, right? So there are plenty of research that show that people who get an MRI first before going to physical therapy or going to some type of rehab um, actually spend more money on a consistent basis to manage their low back pain. It starts this rabbit hole of this kind of cascade of interventions that don't necessarily work. And it's really hard to unsee these scary things that are on your MRI. So, unfortunately, not everyone is up to date on the research, right? So we get a lot of people that have been given bad advice of you just need to get an MRI and see what's going on. And a lot of well-intended physicians say, well, maybe you've tried physical therapy, maybe you've tried massage, maybe you've tried something. The next step is to go ahead and do injections. Well, they don't do injections unless you've done an MRI. So they're not doing the MRI to figure out what's going on. They're just doing an MRI to make sure it's okay to do injections. So um, a lot of times the MRI is not needed. In fact, one study took people that had no back pain at all. So they surveyed people and say, do you have back pain or not? And if you said, no, I don't have back pain, they put you in a group and they took an MRI of your back, right? And what they showed, let me make sure I get the stats here. 88% of people in their 60s showed some sign of disc degeneration or other degenerative changes in their spine, but reported no pain at all. So a lot of times it's something else that's causing the pain. It's the muscle imbalance. It's a joint that's not moving as well as it should, or maybe it's moving too much. Maybe the muscles are overworked or spasming. There's also ligaments and tendons that are in there that are overstretched or a little too tight. And that's your body's way of saying things aren't working the way they're supposed to. Let me put an alarm signal out. Okay. And it just because you have these big scary things that show up on an MRI does not mean that is the source of your pain. Obviously, we have 88% of people in their 60s that have degenerative changes on their MRI. I like to call this wrinkles on the inside, right? As we age, it's a normal part of aging that we get wrinkles, and no one stresses. Well, yes, we stress about them, but we know it's normal, and we know that it's not required to do anything about it. Same thing on the inside, right? There are some wear and tear signs that doesn't have to be linked to your pain. So the best way is to go ahead um, and get physical therapy first from someone who is following best practice. Myth number two, um, bed rest is necessary after immediate injury or a flare up of back pain, right? So we hear this all the time from, most of the time, this is from friends, family members, and it's just kind of been ingrained in us. Oh, you hurt your back, you need to rest up. I want you to go home and I want you to lay down and I want to make sure that you rest, right? And that's actually really bad advice. And the research is very clear that you should encourage people to continue to go to work, continue to do activities of daily living within tolerance, right? So try to do activities that don't cause too much pain, right? So obviously, if something's making things worse, is if you bend over to touch your toes and that really hurts, then try to avoid bending over to touch your toes. However, it doesn't mean lay on your back with your feet up and don't move for a week because that can actually cause a lot more trouble. They used to not know what to do with people that have back pain, and so they would actually prescribe bed rest. People would be put in the hospital and said, well, if your back hurts and it hurts to move, we better put you on the bed because that's where you'll feel better. Well, the research is very clear that regular movement and encouraging light progressive exercise is the best treatment of low back pain. Now, in conjunction with some of the things that we do in physical therapy, we can speed up the process of how quickly we get people out of pain so that they can get back to those regular movements, which are actually going to help you get back to doing the things that you love to do. Low back pain that is persisting longer than 12 weeks, it is recommended that graded physical activity or exercise program that targets improvements in function prevent worsening disability, right? So what we find is if people lie down and take long periods of rest, they get weaker, they get less tolerant to physical stress on the tissues that are flared up, and your body becomes more protective and you actually end up having more pain, right? Um, Sad thing is only, and this is only one study. I've seen studies that showed less, but only about half the people with low back pain are prescribed physical therapy. Most people are sent for, uh, sent home with rest, sent home with pills, recommended for injections and surgery, which we'll talk about in a little bit. Um, but the best practice is showing that some type of hands on therapy and regular graded activity. So, graded meaning that the exercises are slowly going to get uh, more and more challenging. And it really is a mix of a science and an art to figure out what exercises are needed to be able to get you on that path of recovery. Myth number three: pain medications, injections, and surgery are the primary ways to treat low back pain. We talk to people on a regular basis that are struggling with low back pain, and we ask them, tell me, what have you tried so far? And it is amazing that how many people have been given pain meds, have been had injections, whether they're in the facet joints of the actual joints of your back or an epidural, or they have been recommended surgery. And clearly, the research does not support those interventions very strongly at all. So let's first talk about pain medications. Opioids, narcotics, we're talking hydrocodone, Norco, oxycodone, Percocet, Vicodin, morphine, fentanyl. These are all things that used to be very widely prescribed and were pushed on people that would come into the emergency room because of low back pain. In fact, in 2009, 60% of people that went to an emergency room because of back pain were given an opioid. That was at the peak of the opioid crisis. It has been very clearly shown that narcotic and opioid pain medication is not a good long-term management of non-specific low back pain. So now, if you've been in a car accident and you have a fracture in your back or you've had surgery, there is a place for short-term pain medications. However, if it's not mixed with other interventions to help you get past the pain, it is only a short-term fix and causes a lot of problems long-term. Dependency, addiction, constipation, increase incidence of motor vehicle accidents and falls. So this is kind of this is big scary things that can happen if you get stuck on these pain medications, right? So we're improving. Doctors are getting better. There's more control and limitations over how much pain medications can be given out. In fact, if you go to an urgent care, most of the time they won't give you a narcotic pain medication. You have to go to a pain management clinic. They'll give you muscle relaxers or some kind of anti-inflammatory, but they won't give you the pain medications, which is good. We're moving in the right direction. But again, a strong recommendation for physical therapy should be given at the beginning. And a lot of times it's not because we just want the quick fix. We just want to take a pill and we want to be able to move on. Another interesting fact that I have here are people that are greater than 65 years of age are still 2.5 times more likely to be prescribed an opioid. They're given pain medication 2.5 times more likely than someone that is younger that comes in with back pain. That's not the best treatment protocol, and it should not be the first line of defense for people to give these pain medications out. All right. I can talk about that all day, but let's go ahead and talk next about injections. Recent guidelines do not recommend spinal epidural injections or facet joint injections for low back pain. They do recommend that epidural injections or local anesthetic for of steroid for severe radicular pain. So pain that is traveling down your legs. We're talking sciatica or radiculopathy. It starts in your low back, and a lot of times it'll wrap down the back of your leg and all the way down into your legs, depending on what level. That can be really good for if your nerve is going. Let's see if I can get an angle here that looks. If your nerve is going through this hole, you if there is any type of irritation and swelling in there, it can pinch down on that nerve, right? And so if you can get a local steroid to help reduce some of that, that can help, right? However, it is not addressing the cause of why did that get inflamed and irritated in the first place. And so again, I'm not totally against injections. I just think they have to be mixed with a comprehensive rehab program by someone who's following best evidence-based practice. A lot of people will get short-term relief for those radicular symptoms. However, they go on with their life doing the same things they were doing before. The problem never went away, and they get temporary relief, and it comes right back, right? And they go back to the doctor and they say, "Hey, doc, uh, that didn't work." And they say, "Well, I can go ahead and give you another injection," right? Well, they've shown that steroid injections can actually cause breakdown of the soft tissues, so of the cartilage and the ligaments and tendons. That's why they only let you do series of threes, and then they make you wait a while, right? So there's evidence that show that even one steroid injection actually can compromise the soft tissues, right? So it should be used as a if it's going to be used, it needs to be used in conjunction with someone who is following best practice, doing some hands on treatment to loosen up the muscles, loosen up the joints, uh, calm the nervous system, get you out of pain, and then getting you to do progressive exercises that are fixing the problem in the first place, right? If you have tight muscles or tight joints, we need to get them loose. If you have a weak core or you have muscles that aren't as strong as they need to be or you don't know how to use them correctly, then we need to improve that for us to get the root cause, right? So injections are not recommended for non-specific back pain. So if you have pain that is localized to your back, that is not the best recommendation for treatment of that. If you have pain that is going down your legs, and is burning, numbness, tingling, nerve type pain, then that can be a good first step to allow you to then benefit from the interventions that are done by a physical therapist. Lastly, in regards to surgery, right? So the doctor gives you anti-inflammatories or pain medication. You take it for a while, maybe it helps, maybe it doesn't. You go back to the doctor and say, "Doc, this is still hurting. I'm not sure what to do." And he says, "Okay, well, let's go ahead and get an MRI. Look, the MRI shows this, this, and this. We need to do injections to try to help with that joint that looks like maybe the nerve is being pinched." Whatever it is. They go do the injection, you get short-term relief, and the problem comes back again. Well, the surgeon, the only other tool he has other than sending people to therapy, and we already said that only about half of people at most are sent for physical therapy or recommended physical therapy, or people actually go to a place that has enough time to actually help people. Remember, we are one-on-one at Natural Fit Therapy so that we have the time to do the evidence-based practice. A lot of these clinics don't have the time to do what is best because there's so many patients coming in through the door. So you go back to the surgeon. The surgeons only their next tool is the scalpel. That is their main weapon of choice when you are trying if they're trying to manage low back pain, right? And a surgeon does surgery, right? So obviously, if you push enough and you keep coming back and things have failed and you're following the you're not following best practice, then they're going to use surgery as the last resort, right? And surgery should be used as a last resort. So, spinal fusions, disc replacements, spinal decompressions or fusions, laminectomies have all been shown in the literature um, only to be explored if someone has failed non pharmacological and conservative approaches like physical therapy because the results are mixed at best, right? So they don't really know what surgeries are going to solve the problem. Again, we go back to the MRI, right? 88% of people in their 60s show scary things that show up on an MRI. and have no pain at all. So if you have a disc bulge and they go in and they remove that disc bulge and maybe they put a replacement disc in, maybe they just do a discectomy, maybe they do a laminectomy, whatever they decide to do, what if that disc bulge wasn't the cause of your pain? What if it was a muscle spasm or a muscle imbalance or one of your joints weren't moving well, and a still image of you not moving, they saw the disc bulge and they said, we got to take that out, right? So they may have fixed your disc bulge, but that wasn't the cause of your pain, right? And so surgery is, especially for back pain, in my experience, is 50-50 chance at best that it actually helps and that you don't require ongoing um, needs, right? Spinal fusions has been shown to be one of the most overutilized surgeries that is not necessary and ends up causing more problems later on, and in most cases should not be used except for in last resort. The final guidelines is basically you need to be educated. So first of all, educating yourself, watching something like this, getting all the facts and information, really knowing what's serious and what's not serious can really help dictate how well you're going to improve. Overcoming these myths can really help get your mind right when you go to tackle this problem. And if you're worried about these big scary things on your MRI, if you're worried that all you need is surgery, then you can go down this rabbit hole that we see so many of our clients go down that we don't want them to. So hopefully this was helpful. If you want to know a little bit more details about your specific situation, what interventions you've tried, what your MRI actually shows, if you want to sit down and just talk about what your MRI shows, we've developed a free discovery session. And you can come in and book a discovery session with me. We can talk about your specific situation, talk about what you've tried before. We can talk about what the research shows. I can tell you what a plan might look like. It is completely free to just help you make a decision. So if you're interested, you can go to naturalfittherapy.com/keepaustinactive, and you can book your free discovery session to go ahead and talk it over. It's